Gee, what should you do with $300 million during the ongoing COVID-19 coronavirus pandemic that has already killed over 200,000 Americans? Support medical and public health research into better understanding the virus, its spread, and its control. Improve testing and surveillance? Deliver more masks and personal protective equipment to healthcare personnel and others. How about start an advertisement campaign to defeat despair that features video interviews with Trump administration officials and celebrities? After all, why deal with a problem when instead you can make people believe that it is not a problem? Dan Diamond has reported for Politico that President Donald Trump's administration is organizing a $300 million-plus advertising campaign to make people feel better about the COVID-19 coronavirus pandemic that will launch prior to November 3rd. If you are wondering why before National Sandwich Day, keep in mind that November 3rd is not just the day to down your favorite lunch meat and cheese concoction. It is also National Election Day, the same day that America votes for the next President of the United States. Take a wild guess as to who will be paying the $300 million plus bill for this Defeat Despair campaign. The answer rhymes with beef stew and trombone players. Yes, it will be you and other taxpayers, assuming, of course, that you pay taxes. Diamond wrote that 10 current and former health officials told Politico that they have concerns about the campaign's scope, goals and even how it has been funded, by pulling money out of health agencies like the Centers for Disease Control that are in the midst of fighting the pandemic, rather than working with lawmakers to set up a brand new advertising effort with congressional oversight, or drawing on substantial internal resources and expertise in running health-related public service campaigns. Pulling money from the Centers for Disease Control and Prevention (CDC). You mean that organization that's supposed to be front and center in responding to the pandemic? Isn't that a bit like being in the Super Bowl and telling your starting quarterback, "Oh, you know those cleats, shoulder pads, uniform, and helmet that you are wearing? Yeah, we're going to need them for an ad campaign. But keep on playing without them. By the way, go team." Apparently Michael Caputo, the Assistant Secretary for Public Affairs at the U.S. Department of Health and Human Services, HHS, is the brainchild of this campaign. This wouldn't necessarily be the first time that Caputo has done something to affect the CDC. I have covered previously for Forbes how Caputo's team has allegedly been altering CDC scientific reports and how he claimed that CD scientists are plotting to attack Trump. Even more egregiously, he has accused CDC scientists of wearing sweatpants all the time, except when they go to coffee shops. This, of course, would be inaccurate since CDC scientists wear a variety of leg and pelvic coverings,